Hello and welcome back to the Patient Perspectives podcast. My name is Lauren Scholler, and today's episode is a big one. I'll be talking about medical burnout as a patient. This is a topic that is widely discussed as it pertains to medical professionals, but patients with chronic or complex conditions are absolutely at risk of experiencing medical burnout. Medical burnout isn't just exhaustion from appointments and tests. It's also the toll of managing symptoms, advocating for yourself, and balancing all of it with the rest of life. Because in addition to being patients, we're also people and we have to work and we have to pay bills and we have to do everything else that everyone does, but we have incredible medical schedules on top of that. So I'm going to explore what medical burnout looks like, share my personal journey with it, and then talk about what providers can do to better support patients navigating this challenge. When it comes to being a patient, I sometimes say that it's a full-time job because between managing your symptoms, managing your treatment, insurance hassles, and then the actual appointments themselves, it takes hours and hours on end. And so patients have that on top of their regular obligations that they're expected to show up and perform their best at. And it's a lot, when being a patient becomes so overwhelming, it is nearly impossible to show up in those other areas. So, what does medical burnout look like? I think to break it down, it is emotional exhaustion, feeling drained by the constant demands of managing care. It can also be this feeling of depersonalization and feeling disconnected from your care or like just another number in the healthcare system. I think it can lead to a decreased ability to manage your health and to advocate for yourself. And for patients, burnout might manifest as skipping or delaying appointments, neglecting self-care because that can feel like just another task on top of all of the many medical tasks that we already have. Anxiety around medical interactions, and sometimes patients can disengage from their treatments and be labeled as non-compliant when the truth is that they're just overwhelmed. When it comes to the root causes of burnout, overwhelming medical schedules, also taking into consideration the financial and insurance stress of getting all of the prior authorizations and referrals and copays, and sometimes planning procedures so that they can be done once you've met your deductible. And especially around this time of year, at the end of the year, people are pushing to get tests and things scheduled in a timely manner so that they're not faced with the larger costs of getting it done right after the new year. Other causes of burnout could be inadequate support from providers or from support systems at home. And I think a big one for me last year was lacking clear answers or a sense of progress in my treatment. When I was going through the process of being diagnosed with my tethered spinal cord, it was the most overwhelming 6 months medically that I had ever experienced. In all of my care, those 6 months absolutely burned me out as a patient, and I felt exhaustion and fatigue as it related to my medical care in a way that I had never experienced before. I ended up in the emergency room in mid-February because of severe back pain, and I had changes to my gait where I kept tripping over my feet, and I ended up with nerve pain going down my legs. I developed a tremor in my legs, and my legs became very spastic. And so my muscles would spasm very intensely, and the event that really pushed me to go to the emergency room was I had gotten home from work one evening and ended up falling on the stairs outside of my apartment because I could barely lift my legs up onto each step. And so these were pretty drastic changes to my gait in a short amount of time. So I went to the emergency room and I was then admitted for 5 days. And during those 5 days, I had a couple different tests done, but nothing was really accomplished in terms of understanding what was going on. I was discharged from the hospital and told to follow up with a specialist who I couldn't get an appointment with that specialist for a little bit over a month actually. And so I was just kind of deteriorating as I was waiting for the specialist appointment, and I was suffering during that time. And even going to work exacerbated my symptoms, going to medical appointments, commuting into the city on the train, made my condition a lot worse. It even got to the point where if I spent the day in my apartment, going up and down the stairs to do my laundry would send me into a flare-up. And so during that path towards getting diagnosed, and there was a lot of unknowns, so many appointments that I went to where I left without answers, I left without, and I didn't even, I understand that sometimes you're going to go to an appointment and you're not necessarily going to have an answer, right? Sometimes follow-up testing is needed. But I left so many appointments without a path forward, without being able to schedule that testing because the doctor didn't feel like additional testing was needed. And so there was a lot of feeling hopeless during that time, despite so many appointments. I felt like for many months when I was dealing with debilitating symptoms, I was getting nowhere with understanding what was happening. And I think that was the heaviest part of it all, was that I was going through all these motions. I was showing up to the appointments, and my hope was dwindling, but also just the act of showing up to the appointment took so much out of me. And I knew that after I got home from an appointment, my symptoms were going to be exacerbated at the end of it. So there was a lot of anticipating and preparing for feeling worse. And that's a really hard thing to do when you feel like you're going to show up to an appointment and not get anything out of the appointment or not have a better path forward. And I looked at my calendar to see kind of what that time in my life looked like. Last year, I had 42 appointments that included specialists and my PCP. I had 31 physical therapy sessions, so in total, 73 appointments. And if you think about having 52 weeks in a year, 73 appointments, and really those 73 appointments were kind of condensed to the first 6 to 8 months of the year. And so I was having 3 appointments a week, if not more. And it was just utterly overwhelming. And again, I was still expected to go to work and I was expected to be a functioning adult when really my only goal was to survive the day because I was in so much pain. I wasn't sleeping. When you think about having such a constant load of, there's an emotional toll of being a patient, of being a complex patient and not, and going through very challenging things for such a prolonged period of time. That takes a lot out of you emotionally. There's a physical toll of commuting to and from appointments. And like I said, for me at that time, even just the act of commuting to an appointment was so tiring, it was painful, and it took just everything out of me. And there were times when I just I wanted to give up because it was too much, and that is unfortunately a reality of many patients going through complex and chronic conditions and treatments. It's just that it gets so overwhelming. The appointments alone, but also adding co-pays, also meeting deductibles, scheduling surgeries. So there's a lot to consider when managing medical care that I think it's not appreciated enough how hard it is. I think burnout can also be from the symptoms themselves, like pain. For me, that was certainly the case over the summer when my ankle pain got to the highest that it ever has been. I certainly felt burnout from the constant burden of pain. And this impacted my ability to walk at the end of the day, and being in a severe amount of pain over a prolonged period of time, it runs you down. It runs you into the ground. I mean, that was honestly the most amount of pain that I have been in for that long, and it tests your coping strategies. It tests you and it brings you to your limit. And so when you are so run down like that, it makes it difficult to be able to show up to appointments and be present and to be able to have productive conversations with your medical teams when it's just a fight every single day to get out of bed. Some strategies for managing burnout, which this is really hard to do when you're in the midst of such a challenging experience because I think some of these require time and reflection, and it is hard to put that time in when you already feel so down. But I think identifying the main source of the burnout, whether that is the number of appointments that you have, whether you feel like there are communication gaps with your providers, or you feel like you're not being heard by your providers, identifying what it is that is contributing most to the medical burnout can help you to take actionable steps towards mitigating that burden. I would also prioritize resting after major medical appointments or tests. And this, of course, is difficult to do if you have a full-time job, but if you have the flexibility to schedule your appointments on a Friday and then you have the weekend to rest, or if you can schedule your appointments and then the next day have a work from home day so that you can better optimize your environment to be more comfortable during the workday. Those can be some ways to prioritize rest, but I know that's not always possible. And so just keeping in mind that your body needs rest and so making that a goal to give it the rest that it needs can help to minimize some of that fatigue that comes with the constant medical appointments and medical stress. Another thing that I found helpful was keeping a journal of my symptoms that I could bring to my appointments because another impact of kind of this medical burnout or the fatigue of having so many appointments is that you get brain fog, and it can be difficult to remember all of your symptoms and how they impacted you on a certain day or what activities might be triggers for these symptoms. And so I would write them down and bring them in, and that eliminated a lot of the stress of trying to remember it in the moment as my doctor was asking me about it. And it was more conducive to a more productive appointment, I think, because it was already written down and I could just reference that instead of guessing and trying to remember it in the moment. To me, medical burnout, it's more than just exhaustion from the logistics of care, right? It's the toll of the symptoms themselves, the pain, the fatigue, the unpredictability. And I think recognizing this distinction is key to understanding and addressing burnout. So, what can providers know and do? I think providers can play a crucial role in helping patients manage and reduce medical burnout by reducing fragmented care by consolidating appointments. Also, if the resources are available, providers can offer a care coordinator to help coordinate patients' appointments. Another thing that providers can do is in improving communication is using patient portals to make communication more accessible. And this could also allow patients to share their priorities or concerns before an appointment. And this could allow providers to be more prepared and patients to feel more heard at an appointment. One thing that has been important for me in my care is I'll write down in a journal what my questions are, and that just helps me to feel more organized on the day of my appointment because when you're already exhausted enough from your symptoms, it can be difficult to go to an appointment and remember everything that you want to say on the spot. And so that can help to enhance communication and make it more clear between patients and providers if you're able to write it down in some capacity beforehand and help the provider to be prepared. Another piece that kind of falls under consolidating appointments is for providers to offer telehealth options in clinically appropriate situations is another way that might be able to reduce the burden, especially if you're someone whose symptoms are exacerbated by going out and traveling, commuting to these appointments. Or even just facilitating communication with colleagues. If your patient sees multiple providers, can reduce a step that patients often feel that they need to do themselves. Providers can also acknowledge burnout. Ask open-ended questions to your patients like, how are you feeling about your care plan? Are there any parts that feel overwhelming? Recognize and validate a patient's feelings can strengthen that patient-doctor relationship, and also acknowledging that burnout is not a sign of weakness, but really it's a natural response to the challenges of navigating the healthcare system. Again, recognizing and validating burnout, simply acknowledging the fact that patients go through a lot, even before they even arrive for their appointment, to prepare for the appointment, to get all of the insurance referrals, authorizations in order, and then again showing up for the appointment and what that appointment means for their care afterwards. It's not an easy thing. And so simply acknowledging that can produce a stronger patient-provider partnership. For providers to know about resources that they can connect their patients with, like medical coping therapists, especially if they are a patient who has a very complex condition and has gone through extensive medical treatments, identifying those patients at risk for mental health challenges related to their medical conditions can ultimately improve care outcomes. Or peer support communities, places that patients can reach out to find more support and to help them navigate and manage their care. Now, how does this relate to shared decision making and patient-centered care practices? Shared decision making can be a powerful tool in helping to combat medical burnout. When providers present options and ask for the patient's preference rather than dictating a care plan, it helps to foster collaboration and trust amongst the patient and the provider. So, acknowledging the emotional toll of treatment decisions and give patients time to process them can make a huge difference. By addressing burnout and emphasizing shared decision making, providers can improve adherence to care plans, build stronger partnerships with patients, and enhance their quality of life. Because if patients can manage their burnout well and they're not experiencing the heaviness that can come with navigating extensive medical treatments, they can then focus on other aspects of their life that are more meaningful and more enriching. And so, these small changes can lead to long-term benefits for both patients and providers. And finally, if you're in the midst of medical burnout or you know someone who is experiencing it right now, it's important to encourage reconnecting with the parts of life that bring you joy and meaning, whether it's creative outlets, hobbies, spending time with loved ones, friends. All of these moments can replenish your energy and remind you of your identity beyond being a patient. Even though being a patient is an important piece of your life, and it can oftentimes feel like it's such a prominent identity because when you're going through something so life-altering or painful or any of the things that being a patient means, it is not uncommon for those to take up a lot of space in your life, but being able to find those outlets and to find even, one meaningful moment a day, is really important to balancing that life as a patient, but also balancing the mental and emotional health and emphasizing self-care that is so, so important no matter what you're going through. So, medical burnout is real. It's something that many of us face, and I encourage you to reflect on how burnout has impacted your care and to think about actionable steps that you can take, whether it's communicating with your provider, setting boundaries, or seeking support in other ways. And for providers listening, consider how you can make small changes to your practices to acknowledge and address burnout in your patients. What strategies have worked for you in managing medical burnout? I would love to hear from you and hear your stories. So share them in the comments or on social media to keep the conversation going. If you enjoyed this episode, please leave a review to help others find this podcast. Thank you for listening, and I'll see you next week when I'll be joined by our first guest. Be sure to check out the Patient Perspectives podcast on Instagram for previews of upcoming episodes. Take care and see you soon.